You and I first spoke about this, you told me of a couple tragedies that had happened in your community. Maybe you could tell us a little bit about your community involvement and some of the things that started to drive your program.
Yeah, so and when you hear this story, if you're involved in first response at all, it's gonna ring true to you, and that is you have a client, you run on them, and the services aren't there in your community. The partnerships haven't been established, and you see this person heading towards a precipice. And you try and get them the help that they need, and you try and put them in touch with the resources. But the reality is you don't have the knowledge, skills, and abilities to make that happen. And you don't have those partnerships in place to make that happen, to empower that client to get the help that they're reaching out for. So you do what you can do. You take them to the emergency room and they get cut loose, and then they go back home and the same behavior pattern occurs again and again. Until you have a tragic outcome. And we had a couple of cases like that where the resources didn't get to the client. And unfortunately, the ending was very tragic and had just incredible wave impact on the community as a whole. We know that for every completed suicide in our community, the immediate downstream costs are about $26,000 in real dollar costs. And the human impact, especially of the loss of a young person, is unmeasurable. And then the impact to the first responders that have been there, that have worked with those clients, it's devastating. So if I was going to give any advice to someone looking to start a program, I think first of all, what Jaime said is spot on. Each community has to develop a program that plays on the strengths and weaknesses of their community. No two programs should look alike because no two communities look exactly alike. You have to draw on the people that are passionate for providing those services in your community. And you have to work with the partners that you have and that are available to you, the resources that are available to you. So the first thing is, honestly, be the agency that steps up and hosts a meeting. Bring in all the partners, bring in the school districts, bring in your private behavioral health partners, bring in your public behavioral health partners, bring in your law enforcement agencies. Please bring in EMS. We're struggling with this too. Bring in your hospital systems or the closest hospital system. And then work with all of those partners to outline, first of all, what are the problems you're facing? What are your community needs? Conduct a community needs assessment. And then go out and visit other programs. Anybody who's on here today is welcome to come and spend a day with us. Come see our program. Please reach out to Jaime, reach out to Justin, see if you can visit with them and learn from their programs. And I absolutely plug the CRT program in Colorado Springs. What they're doing is absolutely amazing down in that area. And the homeless outreach team with Colorado Springs PD. Reach out to those agencies that are doing innovative programs, and there is no one size fits all. Look at what they're doing, and then look at the resources that you have in your community and the people that are interested, and put it together. Honestly, for us, I hate the term, but it was low-hanging fruit. The partners that were willing to work with us is who we started out with, and then as we started showing success as a partnership, other folks hopped on board. So. Start with a meeting, do a community needs assessment, go out and see other systems. That's the best recommendation I could make.
Tom, you're muted.
Yeah, I got that figured out now. I only did it once though. So I also want to make sure we're inviting people to put questions into the chat. But Justin, do you mind, what advice would you have? And let's see what questions come out of our participants.
I don't have much to add. I think the sheriff and James really adequately covered exactly what it takes to get this going, other than just having the initiative and starting to make those community connections. And I remember having this conversation about 4 or 5 years ago with some community partners about what a mess it would be to try to tie 911 in the city and county of Denver and the paramedics and the fire department and the police department together to try to get a resource like this together. And really it's about taking those first steps and how important that is. There's a lot of initiative out there. There's a lot of drive for these types of programs. So starting those conversations in your community is step number one.
Tom, you're muted again.
Yeah, I'm going to just keep unmuted. This is a question about funding with these programs. And I know, Chief Harper, you're on a grant, and then both James and Jaime have some tax base. But what is the, how is it that you look to sustain funding, and any advice on doing what can be an unpopular thing, which is raising taxes? Sheriff?
Oh, I'm sorry. We're funded through a grant at Office of Behavioral Health. We're funded through a grant at DOLA, Department of Labor Affairs, Local Affairs, and we're funded through this tax initiative, the Strong Futures Tax Initiative currently. But I would tell you that, part of the frustration, part of the hardship and challenge of running these programs is going with hat in hand looking for money. No one grant funds anything 100%. They're all very particular about what they will and won't fund. I'm very fortunate where I have this ballot initiative that kind of picks up what other grants won't pick up. But I would tell you that it's a struggle. The other struggle is the reporting requirements for these grants. In small rural agencies like here in Summit County, we're all the same people. I don't have a grant person that works for me that seeks these out, that reports on them, that manages them. It's a full-time job in itself. So it's difficult. I'm looking at other funding options here within the community because it's exhausting walking around with hat in hand, asking for money. But, the proven success of the program itself is what now, in the beginning, it was obviously tough the first year, but now we've got a year under our belt and we've got such proven success in the community that I'm anticipating the ask this time around is going to be a lot easier.
It certainly helps when you have successes and you have data, and particularly James is talking about saving money. And so that's critical. There's another question, and I'll direct this to you, Chief Harper. Do you know about other communities in Colorado that have similar programs like the ones we've been talking about this morning? And then, and again, I'm asked, it's a tough question, but the question is about Elijah McLaughlin. And do you envision how that might have played out differently if it had been a STAR unit assigned to that a person waving his arms and acting strangely versus a law enforcement response? Would you mind tackling that, Justin?
Sure, and speaking to the other programs, we've been in contact with a lot of other cities and towns in the state and in the country, particularly Arvada, Aurora, Colorado Springs, and other municipalities that have been looking at a similar program to STAR. And I think Aurora is up and running with a pilot that is very similar to the STAR program. They're working with their EMS agencies and fire department there as well. I think from what I've seen in my anecdotal personal experience on that STAR van versus my experience as a paramedic, is that absolutely, I think an encounter with a mental health professional and a healthcare provider that have the angle of how can I help you would be a very different outcome with the Elijah McClain situation. That would be my personal opinion, and I think that's why we're so invested in trying to not only help our community but help our police officers and not putting them in situations that they shouldn't necessarily be in. They're not healthcare providers. They're not mental health care providers in the roles that they're in. And it's unrealistic and unfair to put them in those situations. So how do we help them and support them? And that's our goal.
And you and I are really like-minded on this, and we've talked about this before, that I think we have some responsibility to our law enforcement partners to protect them from situations where they're getting, I don't think any of those officers in Aurora woke up that morning and said, today we're going to ruin somebody's life. And that they're, it is just I think we ask a lot of our law enforcement partners, and that perhaps there are these other resources that can intervene with these sorts of cases, which keeps the public safe, but keeps the people in the community safe, and keeping our law enforcement partners safe. What's been remarkable to me, and at least in my 30 years in EMS, it's always been, if somebody's behaving badly, send the police, because we're going to injure EMS providers and they're just not trained for it. And so it's remarkable to me. Justin, you talked about Star Unit has not had to ask for police cover. The sheriff was talking about how his unit has not had to affect arrests or mental health holds and so on. And so, James, do you mind weighing in? Your program's been around the longest. How have you dealt with this idea that somehow we're going to injure healthcare providers in these interactions? And have you had incidents where someone said, with 2020 hindsight, there should have been a police call?
No. So with our program, if it sounds like it's a dangerous situation, obviously we're going to bring law enforcement in early with us as part of the team. So they come in with us, we come in together, and we come in from the approach that the client is going to set the tone. The client's going to set, if they need to rage, we'll give them space to rage. As long as they're doing it in a way that doesn't impact, doesn't endanger themselves or anyone else immediately, it's okay to scream and yell and let out that frustration and that anger. And, even if you want to break things, really, we'll give you the space to do what you need to do. And then we'll meet you where you're at. We'll come alongside you and we'll actively listen. And as soon as that provider feels safe, we'll cut that law enforcement officer free to go and do what they do. We haven't had any issues with this at all. The only struggle that we've had through the history of the program is with the changes in law in Colorado. There's a lot of times when law enforcement have to back out of the scene now when there's a weapon involved and there's no one at risk. And so historically they would have gone in, secured that scene for us, and we'd go in and meet the client there. Now what we do is we take what's called an indirect map approach, where we actually reach out to that person through other means of communication. So either telephone, text message, email, and we're communicating with them that way. And what's amazing is a significant number of these clients do engage with us indirectly, especially through text message. And we can keep them engaged sometimes for hours via text message. And we've been able to, in a lot of cases, more than 50% of the cases, we've been able to get those clients to agree to meet up with us somewhere else where it's safe for them and safe for us on some neutral ground. And so that's been a tool that's been fantastic for us. We're actually putting our providers through the FBI crisis intervention 1, 2, and 3, so that they garner greater skills in working with clients in behavioral crisis over the phone. And so I think we'll yield even greater results over the long run with that. And then speaking to the medication piece, for us, what we've done is from early on, we've tracked any behavioral medication that we've given, the time it was given, and about 26 criteria around that medication's use, so that we can better understand and tell a better story from the broader perspective about when we're using medications, how we're using medications, and if we're, to make sure that we're being an advocate for the client when that becomes a necessary solution. Most of those clients are the ones that end up going to the emergency room, but we do use Zyprexa and Geodone, for patients who are agitated, who want help, who want to decrease that agitation level so that they can engage better and become more empowered to manage their illness.
And that is a by mouth preparation. It is not
Correct.
The, it's not the shot.
Nope, they have to voluntarily be willing to take those medications. And then again, we make space and create time to allow those medications to start working so that the client can regain control. But it has to be something they want to do voluntarily. And so that's where that motivational interviewing piece comes in. We want to identify what drives them to want to change the situation that they're in that moment. So I hope that answers the question.
Yeah, it does. Thank you. And also another question for you. What's sort of the best way to distribute information on help numbers to rural and farming communities? And we can expand that to ranching communities, I think. And so I think the question is along the lines of, how is it that you, if you will, advertise your services? And how is it that we make people, even in rural areas, that may not realize that there are these kinds of teams, and that that there is money available, or that there is funding to get somebody evaluated at the 2 hours at the maximum anywhere in the state if they are experiencing a mental health crisis?
A great question, right? In the rural environment especially, it's really hard to find those opportunities. And I'll tell you, it's a two birds with one stone kind of thing. The other question was the tax piece. So when we passed our tax initiative, we went to every farmer's market, every public event, everything we possibly could to share with our community this program and the importance of sustaining it with the 50-cent sales tax. And that's the same way we continue to share word about the program in general. You know, we go to the farmers markets, we go to the community events, we go to all of those functions, and we have literature. We let folks know about not only our MAP program, but we also let them know about our telehealth services that are available. We let them know about resources that are available in their community, CPR classes that we have. And we literally spend our entire time during the summer, especially, reaching out, and then we speak to any community partner that's willing to open their door and let us in. So senior coalitions, homeowners associations. We look at it as we are constantly campaigning to show our community that we are the value option in our community, that there is absolutely value to them to sustain the programs that we do. Tom, I'm so sorry, brother. I can't hear you.
I just have to leave myself off of mute is what I have to do. I really appreciate that. It's really smart what you guys do. And another question that's come up for the sheriff. You had previously mentioned interactions with individuals who may have intellectual disability or learning disabilities who are experiencing crisis. And how is it that your team may change their approach, or how is it that they may handle that differently?
You know, obviously they're trying to recognize the difference between a mental health crisis and some of these other disabilities. And they, you know, it's such a large question, right? There's so many variables in that response, but they're trained to handle the response appropriately. But, you know, it brought me up, it brought me the SMART team had a client that, had an explosive disorder. It was a young person, a juvenile. And, you know, every time they had an aversion to people in uniform, to fire and law in uniform. And, you know, once the team started working with this kid, and I mean a kid and his family, and mentoring this kid, they were able to teach this client how to act when they see a uniform. So that the child wouldn't get hurt, you know, it wouldn't turn into a use of force situation, because literally, I mean, a really violent, explosive disorder reaction to uniforms. And so they worked with this child, they worked with the family. This child was down in Denver at a dentist appointment. And this is after, you know, working with this family for a while, and had one of these reactions to the dentist all of a sudden in the way they were dressed. of course, the dentist calls law enforcement. Law enforcement responds, and it was pretty incredible because the way the kid remembered to interact with law enforcement, to calm himself down, some breathing techniques, how to show that he wasn't a threat to law enforcement, to the point that when law enforcement came and they finally were able to resolve the incident, that the law enforcement officer called our SMART team because the kid told them about the SMART team and told them about this incident, and that their training paid off, that there was no violent interaction with this kid, that he immediately did what he was trained to do through the SMART team. And you want to talk about an unbelievable outcome, and also from the parents that witnessed this whole thing, both in the dentist chair all the way out to outside to where law enforcement had the interaction with the kid. So, just that's what reminded me of asking that question, reminded me of, here's someone with not only mental health issues, but some other critical issues.
And probably had been traumatized in his past, no doubt.
Oh, yeah. All
And
of that.
so what a great story to go out on. And I just want to be aware of our time. I want to thank our panelists very, very much for your insights and for your thoughts and for your programs. It is really remarkable. And I think this is the future is looking to be able to address inequities with populations that often don't have access to certain treatments by implementing field providers, and also being able to save their communities time and money and bad outcomes by keeping them away from jails and keeping them away from hospitals. And so I'm going to end my time and just throw it back to Dunn if you have any closing thoughts. But again, thank you to our panelists, and thank you for everybody who's joined us today.
Well, thanks, Tom. I just want to speak on behalf again of Colorado Healthcare Ethics Forum, that this has been an amazing presentation, and all three of you evince the characteristics that Jaime described of passion and commitment and leadership, and that's really what it takes. I hope that these programs can promulgate throughout. I know that our state legislature also should have a stake in this matter, and I hope that they will find some way to relieve some of the funding issues that you have described. So we're out of time, but I think it's Constance also has entered a chat comment. Thanks for your presentation. Excellent work. Tom, your moderation has been amazing. Truly awesome. Thank you so much.
Thanks.
For
This
that,
time I'm going to make sure I'm unmuted.
We'll end the program. Thank you.
Thank you. Be safe, everybody.